Good afternoon. My name is Dave Kerner, County Mayor of Palm Beach County. We're here today at the Emergency Operations Center for a press briefing on the COVID-19 developments here in Palm Beach County. I have joined with me today Commissioner Mac Bernard and Commissioner Greg Weiss and many members of our response effort as well. And we'll be hearing from the following folks. Dr. Alonso, Department of Health, you know her well, lead agency in the COVID response. She'll be speaking on some concerning numbers and trends in this county. We'll also hear from my colleague, Commissioner Greg Weiss, on the importance of wearing a mask here in Palm Beach County and some other thoughts that he's had. We'll also hear from Colonel Allen of the Palm Beach County Sheriff's Office regarding the COVID education and compliance team that we are launching today during this press conference. Then finally, our incident commander, Virginia Baker, who's also our county administrator. With that, I'll turn over to Dr. Alonso for an update on our numbers. Doctor?
Thank you, Mayor, and thank you, County Administrator Virginia, for doing such a good job of keeping us all together. When we opened up our business a few weeks ago, it seems like a long time ago, the average of our cases per day was 68 cases per day. After being open for a while, those cases went up to 102 cases per day, which is a 60% increase. As of June 1st, the numbers have averaged 220. That's a 100% increase. When you have a line going up that doubles, that's called an exponential linear regression. And so therefore, this is significant. The only weapon that we have against this silent infection that we know very little of is social distancing, the use of facial coverings, and staying 6 feet apart, washing your hands, washing surfaces, cleaning surfaces that you come in contact with, and keeping your hands away from your face. It's a very old medical practice, and it's been around for a long, long time. There's no technology in it, there's no fancy medicines in it, and that's the only weapon we have. And that's what happens in a pandemic. You have a new novel virus that we don't know, that we have no vaccine against, and so therefore, that is the tool that has been utilized since people didn't really know what it was, but it worked. It was common sense at that time to do these things. That's what we need to do if we want to keep our businesses open and save the lives of those who are most affected by this virus. We also need to follow the governor's orders that were given to us when we decided to open. And those orders included and insisted on social distancing and everything that I repeated before. So I need to specifically lean on the business and the employers. Please enforce and take serious the plans that you submitted to the Emergency Management Division. You agreed to do certain things, and some of those certain things was social distancing and keeping your patrons and most of all your employees safe. Look at the example of the woman up in Jacksonville, a 40-year-old woman who went out with a bunch of friends and she tested positive, and 15 of the friends that were with her all tested positive and now have COVID. That tells you that this is a very aggressive virus. This is not your common cold and it's going to just go away. This is a serious pandemic, probably the most serious pandemic that this world has seen. It's all around the world, it's not just here. Unfortunately, the United States right now is the #1 in terms of the highest number of cases and the highest number of deaths in the world. So we need everyone to work on this. We need everybody to take this serious, and we must educate your staff, our partners, our neighbors, on what we have to do so that we can continue to have our businesses open and go forward when the time comes to be able to open more businesses and get back to a more normal situation. It's not going to be normal for a long time. This isn't going to disappear. It's here. The fact that our positivity rates are going up, we're looking at 2 positivity rates. The positivity rate of the total people that we've tested and the positivity of the labs that we're doing each day and how many of those labs are positive each day. Okay? What that tells us is that the virus is thriving. When everybody was on lockdown, the virus didn't have anybody to jump on. So it diminishes. Our positivity went down. As we opened and people started feeling better and we started loosening up and everybody felt a little better, then the virus had more people to attack and to make positive. That is what's going on. It's a combination of the testing and the fact that the virus is very active and it's a very strong virus that can make with one person 15 people positive. Our contact tracers are going out, they're calling people, they're actually going out into the community because we realize that people don't understand this virus. They're afraid to give us their names of their employers. They're afraid to give us the names of the people that they're with because they're afraid they're going to get fired. So please, as an employer, talk to your staff. Tell them that if they are sick, they cannot come to work for their safety and for the safety of your business and for the safety of the other staff that you're working with. I am very happy about the testing efforts that we've put together here in Palm Beach County. We have risen to the challenge. We're testing people, we're testing everybody now, even without symptoms, and we're finding that a lot of people that have no symptoms are some of the people that are spreading the virus. And so with that, I'm going to stop and let other folks talk, but my main message to you is please communicate, spread the word, explain to people why this is so important. We're going to be going out into the neighborhoods. We're going to go out into the areas that we need to go. We have a great team, not only the healthcare district with the drive-throughs, but also we have over 60 commercial sites. I don't think that other counties have more places to get tested than we do. And we have both government and nonprofits helping us, fire rescue helping us. There's plenty of opportunities to get tested. So the final line is, remember, we're stronger together, 6 feet apart.
Thank you, Dr. Alonso. I hope the community understands the important nature of these trends, the important nature of Dr. Alonso's comments here today, and the concerning numbers that we have here in Palm Beach County. To speak a little bit further about that, we're going to hear from 2 of my colleagues, Commissioner Greg Weiss, Palm Beach County Commissioner, and a member of Congress, Congresswoman Lois Frankel. Congresswoman?
Okay, thank you. Nice. Thank you to the County Commission for letting me barge in on your press conference. They have such a hard job now, and thank you, Virginia Baker and Dr. Alonso, for all your work. You know, I wanted to come out here today really for 2 main reasons. Number one, I'm very alarmed by the spike we see with the virus, but more importantly, what I want to just have a message of, we're all in this together. It's sort of like being in a war. It's a war against the virus, and we have to remember we're all in the foxhole together. And if we can respect ourselves and respect each other, we're going to be okay. And as Dr. Alonso stated, there is no vaccine now, there's no cure, but we do know how to keep ourselves and others safe. And that's why I want to thank you to the law enforcement here. And you know what? Isn't it sad that we should even have to send out law enforcement when we're just asking people to do something very, very simple? If you're not going to stay home and you're going to go out, when you are inside with other people, socially distance, and wear a mask. And just to say, I was at the market today, and I would say maybe 30% of the people were not wearing masks. And what I have to say to them is this: this is not about what political party you're in. This is not what age you're in. This is not freedom versus non-freedom, or whether you like business or you don't like business. For businesses to be successful and for us to stay open, which what we want to do, is people have to be healthy. Workers have to be healthy, and customers have to be healthy. So I thank you to the county for moving forward, and just not to divert attention to their announcement today, just to say, and they know this, that Ted Deutsch, myself, and Alcee Hastings wrote a letter to them yesterday, and we have strongly urged them when they next meet to pass an ordinance that requires the wearing of masks in essential businesses and any other place that the health department deems necessary, and in addition to step up the communications so that folks know how to stay safe and keep other people safe. Thank you very much, Mayor. I yield back to you.
Good afternoon. I'm County Commissioner Greg Weiss, District 2. Just asking the public to please follow the guidelines, the businesses, follow the plans that you all have agreed to that allowed us to open up and move our economy. We have all made tremendous sacrifices, and we don't want to let those sacrifices go for naught. And the way we make that happen is by following the guidelines: social distance, wear a mask. And we talk about numbers. Well, they're not numbers. These are our fellow human beings. These are our fellow citizens in Palm Beach County that are getting infected, and unfortunately, some of them are dying. These are people with lives, and I implore you, I have been begging you before, I will continue to beg you to please, please listen. And just because something is open doesn't mean it's safe for everybody. So think about what you're doing, and we'll get through this. We will get through this all together. Thank you.
Thank you, Commissioner Weiss and Congresswoman Lois Frankel. Again, continuing down the path of the concerning trends here in Palm Beach County, let me say this. Palm Beach County led the way in the beginning by opening up here first in South Florida. That was a decision made by county leadership in the governor's office. It should be no surprise that as our economy opens up and we bring relief to those that are hurting economically, that we're also going to experience the first level of community spread first here in South Florida, and we're experiencing that. Now, the trends, again, are concerning, but perhaps not that surprising, given that we started or we left the train station first. That doesn't mean we're not going to make mid-course corrections, and we are going to do that, and much of today's press conference is about different strategies that we can take moving forward. We also thank the federal government and our members of Congress for the CARES Act funding. We received $261 million here to assist with our response in combating COVID, and we're putting those monies to good use, Madam Congresswoman. With that, and with the innovation that Palm Beach County is bringing to this state in this crisis, I'd like to announce the COVID education and compliance team here in Palm Beach County that will be based out of the Emergency Operations Center, which is where we're stationed here today. The goal of the COVID education and compliance team will focus precisely on what we've discussed thus far. That is that there is a law through executive order by the governor, and there's law set by the county leadership through our executive orders. Those laws have the force of law with them, obviously, and compliance is not suggested, it is required. And all of you in this community know that there are business owners and restaurant owners that are doing everything that they can to ensure the safety of our constituents and our residents. We know that's the case. We also know that there are a few bad actors there. Let me talk about the men and women that are doing a great job thus far in our community. There is a somewhat confusing multi-layer set of regulations that are put down to protect us. The emphasis of the COVID education and compliance team will be education first. Educate, educate, educate. As part of the COVID funding that received through the CARES Act, we have purchased an additional 6.5 million masks and other hand sanitizer, for example, partitions, things that restaurants and businesses can use. And the men and women behind me that comprise the COVID education and compliance team, in their education duties, will be pushing that out into the community. We are here to help, we're here to educate, and we're here to help execute on this mission with you being a partner. The members of this COVID education and compliance team consist of the Sheriff's Office of Palm Beach County, the Department of Health, Palm Beach County Zoning and Code Enforcement, Palm Beach County Fire Marshal. Then we have members from Boca Raton, Boynton Beach, Delray Beach, Jupiter, Town of Palm Beach Gardens, and West Palm Beach, and their relevant police departments. Each one of these members of the education and compliance team have been selected for the ability to communicate with the community effectively and for their ability to understand the complex set of regulations that we're going to be continuing to educate the public on. We thank them for their public service. We have no doubt that as they go out into this community to educate and seek compliance, that they will do it in the most professional and most meaningful manner possible. However, there are bad actors in this community, and we can encourage and suggest all we want. But for those business owners that do not want to comply with the governor's order and our order, there will be an enforcement aspect and compliance aspect to this team. We will utilize the full force of the law from beyond education and compliance, but also notices to appear, regulatory restrictions, pulling relevant licenses, and in the most rare circumstances, criminal prosecution. We hope and pray that it won't come to that. So we ask that before we launch this education and compliance team today, that we give fair warning to those business owners that have acted outside the law. Having said that, I'm going to invite Colonel Allen from the Palm Beach County Sheriff's Office for a brief statement, and then we'll continue with the press conference on some other issues of great importance. Colonel?
Thank you, Mayor. Colonel Bob Allen from the Palm Beach County Sheriff's Office. Just want to announce on behalf of Sheriff Rick Bradshaw, the Sheriff's Office is excited and happy to participate in this countywide opportunity to get out there and help educate the public. Like the Mayor said very well, that our first goal is to educate. Second goal is to gain compliance. We're excited to get out there. We're a force multiplier for the county. We'll work with all our law enforcement partners, get out there in the local businesses to educate, and only if absolutely necessary to gain compliance through enforcement. Thank you.
Thank you, Colonel. This education and compliance team is from municipal level all the way to the state level. It involves every major municipality in this county. It is an effort to come from the community with educational resources, and that's precisely what it will be. For those members of the community that want to reach out to the education and compliance team, whether it's seeking guidance on how to comply with the law or concerns with the neighboring business, we have a phone number, 561-24-COVID. Again, 561-24-COVID. That's also 561-242-6843. 561-242-6843. We also have an email address, covidcompliance@pbcgov.org. Again, that's covidcompliance@pbcgov.org. These men and women in uniform and the regulators that are attached to this team know their communities well. They know who's acting outside of the law, and they know how to interact very effectively with the members of our community, and we're excited to have their support. I'll now turn it over to our incident commander and county administrator, Virginia Baker, for some positive news regarding the CARES Act and other aspects of our county's response. Ma'am?
Good afternoon, and thank you for being here. Thank you for your partnership and continuing to get out the word to our community about how important it is to wear the mask. And I want to thank you in advance for continuing to help support, pass the word out to our members to wear the mask, to do the social distancing, so that we can continue to move our businesses forward and start to continue to move our businesses as well as our community to a new normal, but most importantly, to flatten the curve. We're spiking, and we need your help and in flattening the curve. Our CARES Act Restart Business program is working very well. We've expended roughly about $12.3 million. We've sent that out to 731 of our businesses. We will continue to process applications. We roughly have 2,469 applications that are in review. So we will continue to process and move those forward. But it doesn't do us any good if we don't flatten the curve. We have got to work together to flatten the curve and keep these businesses open. We all want to work, but we must work together to keep our community as safe as possible. And so we're depending on you to do so. We've also allocated dollars to assist people with rent assistance. We roughly have about 2,340 rental and utility applications that have been created and submitted within our system. Our employees are processing those, so please move forward with submitting your request for rental and utility assistance. Again, wear the mask, do the social distancing, wash your hands. When you're sick, stay home. So we do appreciate you helping us. Thank you.
Very good. So that concludes this portion of the press conference. I'm happy to take some questions if you have them. And I'll just, again, a special thanks to the men and women standing behind me in law enforcement and county government regulation that are going to be out there on the front lines educating our community and ensuring compliance with the relevant laws.
Mayor, could you talk a little bit more about the enforcement aspect of the team? What exactly will be enforcing on campus?
Absolutely. The question was, what is the goal and importance of the COVID education compliance team? As we all know, for our economy to open in phase one, we were required to abide by a set of rules that the governor passed down. For example, when you go into a restaurant, there needs to be employees wearing masks, for example, or there has to be a certain amount of capacity. Right now it's 50% capacity. The bar can't be open. There's a litany of important social distancing rules that have been reduced to actual regulations, and when those aren't followed, then the community education and compliance team will go in and educate those businesses on how to do a better job. Again, in those rare instances where we've seen just abject failure to even comply with the law, which I've seen personally, then enforcement action needs to be taken. Danielle.
Isn't it past time to educate? I mean, we've been doing this for months now. I know you can hear me. These businesses have submitted plans. They know what the rules are. This has been going on for months. Isn't it past time to educate them and just start enforcing?
The question was, isn't it past time to educate because we've been educating for so long and go right to enforcement? I come from a different perspective. I've served in law enforcement since I was 19 in some capacity until my time in elected office. I think it's important to, A, understand the plight of the business owner right now. Most of the people are doing the best they can do. And even if they are complying, this team will help them understand how to do an even better job. Just because the bare requirements are met doesn't mean there's not a better job to be done. And quite frankly, for those that are well beyond education, ma'am, yeah, we need to enforce, and this team is prepared to do that.
Can you just speak to the ICU bed situation? The ICU capacity is decreasing. What's the situation in Palm Beach County? What's the level of concern?
So the question has to do with the ICU capacity in Palm Beach County, and I'm going to turn it over to Dr. Alonzo. I have some minor comments on that, but let me get an expert up here first.
At this moment, we are fine with the hospitals, okay? Each hospital has a contingency plan for surge. Every single hospital has that. Every hospital has the ability to move beds around to, for example, if they get really, really crowded, they can stop elective surgeries and other procedures that each hospital has. Right now, everybody's working together, all the hospitals are working together to report to us on a daily basis so that we know exactly where it is, and they know. I have talked to many of the CEOs and their incident commanders that they're still using to make sure that if they need any help of any sort, we're there to assist them. But the hospitals know how to move their beds around to keep capacity, okay? So they're doing fine right now. There's no need to panic. We don't want to get to the point of panic, all right? And in the beginning, when this whole thing started, you saw that we put together plans, we had tents outside. We were able, by doing the right thing, stop that from occurring. And that's what we want to do now. We want to make sure that, yes, we're watching it very closely, but we don't want to get to the panic state, and that's what we will do. The thunder agrees with me, that's why it's... All right, so that's what we want to do. We want to make sure we don't go to the point that we need to panic. Thank you.
And beyond that, I mean, our ICU capacity has stayed pretty much consistent. It's gone up, down a little bit here and there. But understand that also the economy is essentially open. The new normal is starting, and so you're going to see more traumatic injuries enter the ICU versus COVID, and we have to balance that. We never had to put up our mobile field hospital. We're prepared to do it. It's not something that's in the near future, but course corrections are important. This would not be a pandemic if it didn't come with its own unique challenges in this county. And so as we see these numbers creep up, we as county leadership are responding. CECT is a prime example. We have some other initiatives that are coming out soon as well that we think will be very beneficial. Ma'am.
We've all discussed about the importance of wearing face masks. Why up until this point haven't you required patrons or customers to wear face masks in businesses?
The question generally was, why hasn't the county made wearing a face mask mandatory? It's something that we're considering. In fact, the board's meeting on Tuesday to take a vote on that. Obviously, that's a policy decision that in my role as a county mayor, I'm not empowered or willing to make on my own. We're going to have a robust dialogue about it, and perhaps it is that time to make a course correction. Yes, ma'am. Say that one more time. Well, for one, the question was, what do we need to see happen to go to a full phase 2? Remember, we never made a request to go to a full phase 2. We had a very narrow request to go to phase 2. But certainly we need to reverse course on the trends. We anticipated community spread, but there is only so much community spread that we're willing to tolerate before we open up the business community more. For me, my personal metric, aside from the ICU and COVID-like and influenza-like admissions to the hospital, is compliance through the business community with the laws and regulations that are in place now. I'm not inclined to push this economy to open further if bad actors continue to act bad in this community, and that's why we have the men and women behind us to help us turn that corner. Yes, ma'am.
Alternatively, what does it then take to go back and shut down again?
The question was, what would it take to go back and shut down again? I don't want to think about that. I don't think that any of the metrics indicate that we're going to have to go put the milk back in the bottle. That's a very difficult thing to do. So I don't have a personal metric that's going to say, oh, we got to pull the plug on it. Quite frankly, I have the trust and faith and belief in Palm Beach County that we're going to do the right thing moving forward and that we won't have to consider those options. Ma'am, Hannah?
How many people will be on this compliance education team, and will we be mainly responding to complaints, or will we be random text services?
So right now we have, I think, 7 individual law enforcement agencies at the municipal level. We have the Palm Beach County Sheriff's Office. We have some analysts from those agencies, the Department of Health, and some of our internal regulatory leaders in the county government outside of the Sheriff's Office. I can't give the exact number. It may ebb and flow over the course of this team, but with precision, I don't know how many are going to be on it at any one time. But more importantly, to answer your second question, this is a proactive element. This is a proactive effort. I want the business owners that have been complying in this community to know that they don't have to call and complain on their fellow business owners anymore, because this team's going to go out there proactively and do spot inspections. And they're going to do it in an apolitical way. And they're going to do it across city boundaries and municipal boundaries. And no one's ever going to know when they're coming and at what time. And that's the importance of this team, is the anonymity of it and the removal of any political influence from it.